Hello everyone, good evening. I think most of us are already here, so
Good evening.
shall we begin with the session
Evening,
today?
sir.
Yeah, so I'm Dr. Gaurang Baxi. I'm Professor of Physiotherapy at Dr. D.Y. Patil College of Physiotherapy, Pune. I'm also Additional Director of our Faculty Development Programs conducted by our university. So I have been there in the sessions, silently observing all of you interacting, but today is our first formal interaction. So happy to be with you in this group. So today we would be kind of moving ahead and covering two more important sections. We will first begin with something known as domains and taxonomy. So have you all heard about these terminologies? Are you aware of this? These terms, domains, taxonomy. Would anyone like to share? Have you ever heard these terminologies? Or are they totally new for you?
To
We heard,
an
but
extent,
don't know about
we're
much
aware
about
of
that.
that.
Hello? Yeah.
Bloom's taxonomy,
Yes, the Bloom's
yes,
taxonomy, yes.
I'm aware
So
of that.
you're aware of it. Okay. How about the others? You can just raise your hands if you have heard about this.
No, sir.
Yes, sir. No
Okay,
idea, sir.
fine. So what we will do is I now just share a short presentation and we'll just understand what exactly is this and what do we mean by Bloom's taxonomy. Can you all see my screen now?
Yes, sir.
Yes, sir.
Yes.
Yes. Okay. So as you all correctly mentioned, the concept of these domains and classifications was just first given by the educationist Bloom in the 1960s. So we'll just see what exactly this is for those of you who are new to this concept. So what we will do in this session is that by the end of this session, all of you should be able to enumerate what are the different educational domains. We'll try to understand the different levels within each domain and understand the application
Pardon
of
me,
this
sir.
domain and taxonomy in the learning, teaching, learning process.
Pardon me, sir. Sir, can you just keep it in a full screen mode, sir?
Okay, it was not full screen.
Yes, sir.
Just a minute. How about now?
It's not visible right now, sir. Yeah, that's full screen now. Fine, it's
Full
fine, sir.
screen now?
Yes, sir, it's
Yeah.
fine. Thank you, sir.
Yes. So these are the objectives of today's session, which we intend to cover. So what is learning? Learning is essentially a process that results in some change or the modification in the way one thinks, feels, and does. So when we talk about thinking, we are referring to knowledge. When we talk about feelings, we are referring to attitudes and behaviors. And when we talk about doing, we are referring to the skills. So these are the three basic areas under which learning can be classified: knowledge, attitudes, and skills. And these are the three domains under which this were being classified in the Bloom's taxonomy. So when we talk about the knowledge domain, it is referring to the cognitive domain. When we talk about the attitudes and values and emotions which the students need to kind of learn, it refers to the affective domain. And when we talk about skills, it refers to the psychomotor domain. So yes, the cognitive domain referring to the domain of the head or the mind. So it is basically the knowledge, understanding, and application of knowledge which we want our learners to get. Psychomotor domain refers to domain of the hand, referring again to the physical skills which the students need to learn, and the affective domain, which is the domain of the heart. So this deals with the attitudes, values, and emotions which the learners need to learn. Now, let us just try to understand each of these domains in a little bit of detail. So we have a couple of images on the screen. I would want somebody, if you can explain what exactly do you see, what's going on in this picture? Can somebody share?
One student is presenting Gita pattern, sir,
Yes.
and the others are listening to that.
Yes, absolutely. So it's a competition. It's a Gita Pathan competition which is going on. And this child over here, he is narrating the slokas of the Gitas. Okay, and then of course there's a teacher and there are audience who are listening to it. So this is the first level of the cognitive domain, which is knowledge and recall. The child has memorized the slokas of the Gita and he is able to recall them. Okay. But do you think he would have actually understood the meaning of those slokas and the verses?
No, sir.
No, no, sir.
Do you think he will understand?
Maybe no.
Probably not.
Yes,
Yes?
yes, sir.
But he memorized them and he is able to recall them. So this is the first level of the cognitive domain where the student is able to recall whatever he has memorized. Not necessary that he has actually understood what he has read and what he is able to recall. But this is the basic level. He has knowledge and he is able to recall it. Now let's move ahead. Another picture over here. What do we see here in this image? Can someone describe this image over here?
That person is making a plan how to get that honey from that hive. See?
Exactly, yeah. So even
Yes. Plan.
before making a plan, he is now looking at this beehive and from his prior knowledge and experience, he knows that from this beehive he can extract honey out of it and make money. So this is the next level within the cognitive domain, which is comprehension and or some kind of understanding. Initially, there was just knowledge and no understanding. After that, now some level of understanding is coming into the picture. Now, what do we see here? The same fellow. What has he done?
That person is making planning in a higher level how to artificially do a
Culturing,
farm. Yeah.
culturing be
Correct. Absolutely. So now that same fellow, now he was motivated enough. He knew that from the beehive he can extract honey. So what exactly did he do? He kind of analyzed the entire structure of the beehive. He broke it down into its components. He studied the hexagonal structure of it. He realized that if he catches the queen bee, then the other worker bees will come, and then so he has finally applied the knowledge, analyzed it into its components and broken down into its various components, studied it and finally synthesized or created something new out of it. So these are the further three levels of the cognitive domain, which are application of knowledge, analysis, and then further to that is synthesis. So these are, we started with just knowledge and recall. After that came understanding. After understanding comes application of knowledge, then analysis, and finally synthesis. So these are level 3, 4, and 5. And finally, what do we see here in this image?
The person is planning to get out of the problem.
Okay, so we have the surgeon over here. The surgeon has examined the patient and now he's telling the assistant that, come on, get ready. This lady now needs a cesarean section. So what exactly is it doing is now he's taking a decision or a judgment. So how is he able to take this judgment? After a proper thorough evaluation and going back from his knowledge and experience, the doctor is now able to take this decision. So this is the highest level of the cognitive domain, which is evaluation or judgment. So when we why are we talking about this? What is the application of this? We saw the different levels: the knowledge, understanding, application, analysis, synthesis, and evaluation. So how do you think they are relevant to us as teachers, as educationists?
students assessment, sir. For students assessment,
assessment of the
Okay.
students and planning based on the existing
Conduct of examination.
solution.
Correct. So if we recollect, this is how our students learn. In the first few years of their education, we are giving them a lot of knowledge, and gradually after gaining that knowledge, some level of understanding comes. Then we move on to application analysis, and then finally, maybe in their final year or internship, they reach a level of independent decision making. So this is the hierarchy of education which we are anyhow following when it comes to teaching the knowledge domain for our students, and this is the rationale behind it. That the entire educational theoretical component follows these hierarchy of the cognitive knowledge. Now let's. Any questions till now? Anyone? Okay. So now let me just share my screen once again.
Sir, I have a question.
Yes, ma'am.
Sir, how do we implement all together these cognitive levels in one single class or throughout the course?
So what do you feel? I would like to ask you that question. That now, if you have understood what are these domains, and you understand that they are at different levels, how can we actually make use of this knowledge in our regular teaching? Or maybe, ma'am, let's do one thing. Let's just hold on to this question. Let's complete the rest of
Yes.
the domains, and then we'll come back together collectively. Okay. So I'll just share my screen once again. Is my screen visible now? Can you all
Yes,
see
sir.
my screen? Yeah.
Yes, sir.
Okay.
Yes.
So let's move on to the next domain, the psychomotor domain. What do we see here? One more image, one more picture. What's going on here?
Newspaper vendor is throwing the newspaper while riding the bicycle. Skill.
Exactly. So this is the first step of learning any skill, which is observation and motivation. So newspaper vendor is throwing the newspaper. But this child over here is observing him, how he is throwing the newspaper, not just while using a single hand, but he's also riding a bicycle at the same time. So for learning any skill, this is the first step of observation and motivation. So what does that boy now do? What is he doing?
Now he's trying to learn the bicycle
Yes, and how is he learning?
by some mentors
Yeah. So
or
by
by
yes, by
taking some
practicing himself, and of course he has somebody who is there besides him, somebody to
help.
teach him, somebody to guide him, somebody to correct his mistakes. So this is the next step of learning of the psychomotor domain, which is imitation. So first there is observation and motivation, followed by imitation, and after a period of time, this chap is now able to ride the bicycle independently and wave his hand at the same time. So this is the highest level of the psychomotor domain, which is automation. Okay, so in psychomotor domain, we had first observation, followed by imitation, and finally automation. So again, if we reflect, uh, when it comes to teaching any kind of skills to our students, isn't this the method which we follow? We first make our students observe, then we make them practice, and with repeated practice over a period of time, they are able to perform the skill or the task independently. Isn't it so? Yes or no? Do you agree or not?
Yes.
Good. So this was the psychomotor domain. We'll just finish the next domain as well and then have our discussion. So the third domain was the affective domain or the domain of the heart. What do we see here? What's going on in this picture here?
morals and values are being taught to the student by the mother.
Yeah, so what exactly is happening? Can we just describe this picture? The mother is giving some alms to a needy person,
Yes,
and the child is
observing.
observing his mother. So this is the first step of developing any attitude or behavior is receiving values, and that again comes by observation. What do we see in this second image? Can somebody describe the picture over here?
One person is hiding behind that bus shelter, sir,
Yes.
and one person is asking for that person who is hidden behind that shelter.
Yeah.
The person is in a dilemma whether to answer or not, whether to follow that path, whether to give the
Exactly. So this is the next level of affective domain, which is organization of values. He knows that he should always tell the truth, but over here now he needs to decide whether he should speak the truth and allow somebody to die, or whether it is okay to right now in this situation tell a lie, but then saving a life is more important. Okay, so we all receive different sets of values, but a time comes when we need to kind of prioritize or decide which value is important over the other. What do we see over here in the next image? Does anyone know this story?
So it is Pandava's story. Sir.
Yes. Can
Where
somebody share briefly what's going on in this story?
the Pandavas are climbing the Mount Himalaya to ultimately go to heaven, and only
Yes.
Yudhishthira do this, and rest could be. One dog was following them.
I think he wants to go to heaven, but I think Lord says that he cannot come to heaven. Dog cannot come along with him.
Yes, absolutely. So what did Lord Yudhishthira say at that time? He
Uh,
refused to enter heaven if the dog is not allowed.
Correct, sir.
Because why? Because the dog had been his partner throughout his journey right from the beginning. So he was even willing to sacrifice entry into heaven if the dog was not being allowed into it. So this shows his character, his personality as a human being. Okay, so this is the highest level of the affective domain, which is developing a character again, once again. So now, when it comes to why are we talking about all this? What is its relevance to us? We talked about the cognitive domain again. We saw the different levels within the psychomotor domain and then the affective domain. Why is this relevant, or how is this relevant to us in our health sciences education?
Ethical values or patient communication skill. So
Okay.
one has to have that.
Yes. So, so these are what are
Those
the other attitudes, values which you want our students to learn? You mentioned communication skills, ethical behavior. What else?
The students should not blindly follow something. They should use their logical value to
Okay.
just verify the fact. For not they should not mug up the things. So just verify the facts. How to say, by doing proper analysis and then applying them.
Correct.
And
So
even they can counter the teacher if the teacher is somewhere wrong with the proper evidence. I think they should stick to their point instead of being following blindly.
correct. So I think the point is that a lot of these attitudes, values, we want our students to develop and learn these, but is there any formal way in which we are teaching these? How do we
no,
teach communication skills? How do we teach them to become ethical practitioners? How do we
rules.
teach them aspects of empathy? No. So these are all attitudes or behaviors which they are silently learning by observing us as teachers in the first place. But then there is no formal structure in which they are being currently trained when it comes to the affective domain. So we as teachers, I think it's important for us to kind of realize the importance of these behaviors which we want our students to learn, and accordingly create structured educational experiences which will help them develop these attitudes and behaviors. You're talking about the psychomotor domain. Uh, we let it be any kind of skill. I'm sure dentistry is also a highly skilled based profession. So, how do they learn those skills? You first make your students observe yourselves, observe the teachers, observing seniors. Then you, after a period of time, you allow them to practice first on mannequins. Once they develop a certain level of competency, then you allow them to practice on real patients, and over a period of time with repeated practice they will develop those automations and the skills to a level of expertise which is expected. In the same way within the cognitive domain, somebody was mentioning that how do we apply this knowledge when it comes to the cognitive domain. So when the students are totally raw and new, our we focus our teaching in terms of knowledge and understanding the lower level cognitive domains. But as the students are progressing along the curriculum, second year, third year, final year, our teaching focuses slowly from just giving knowledge to making sure that they are able to understand, apply the knowledge, analyze it, and develop the problem solving skills, analytical, critical skills, use them as they progress further along the curriculum. So, our entire teaching learning is based on this hierarchy of education, which we are already following. This is just a structured format to make you realize that this is a very formal way of doing this. What we are, or the way we are teaching, is exactly in lines of Bloom taxonomy, which has just been introduced. So, this entire classification, which we have just shared over here, is what is the Bloom's taxonomy. So, can you see the screen again? Yes, no? Yeah. So to summarize, this the cognitive domain, we had first knowledge
Sir,
and
not in slide
understanding.
mode, sir. Sir, not in slide mode, sir.
How about now? Can you see the screen slide now?
Yes, sir. Yes, sir.
Yeah. So just to summarize what we have discussed till now, the cognitive domain, we had knowledge and understanding, application, analysis, synthesis, evaluation. The psychomotor domain, we had imitation, automation, and control. And affective domain, we had receiving and responding to values, organization of values, and developing a value complex. So how is now the next slide will have a few verbs. I want you to identify to which domain does this belong. If I use the word enumerate, this falls under which domain?
Cognitive, sir.
Cognitive, yes. Explain.
Uh,
Cognitive
uh,
also.
Again,
cog-
cognitive. Yeah. Enumerate would be at what level?
Level 2.
Level 2.
Level 2. While enumerate, somebody can
Basic,
enumerate
basic.
even without understanding. Enumerate can be level 1.
Level
Yes.
1.
Yeah. Explaining maybe,
Level.
explaining
Level
can come with some level of understanding. So that's level 2.
Yes.
To perform,
Still higher level. Third.
perform would be psychomotor
Psychomotor.
domain.
Psychomotor.
To solve,
Higher level of cognitive.
solve can be again higher level cognitive. Classify,
Higher
Level
level.
6.
Higher level
okay.
of cognitive.
Higher.
Displaying behavior,
So behavior,
And
attitude.
The
psychomotor,
affective
sir,
domain is there.
observes and gets motivated. Psychomotor.
display behavior
Yes.
would be which domain?
Psychomotor
Psychomotor.
behavior.
Not
No.
psychomotor.
Why
Affective.
psychomotor?
Third one.
So it can
Behavior is an
Behavior, so affective domain.
arts
affective domain. Yes.
Again,
comparing
cognitive, cognitive higher level.
cognitive
Demonstrate commitment.
Affective domain.
sir.
Psychomotor.
Correct. Correct.
Commitment. Okay.
Okay, so the point is now when we when we would be talking about writing educational objectives, we would be writing them from each of these domains. So we need to keep in mind what domain we are referring to and accordingly select the most appropriate adjective. So we'll have an activity on this shortly. But now to summarize, what is the use of the taxonomy? It helps permit analysis of the learning process. It helps us as teachers in educational decision making. It helps teachers to formulate educational objectives to plan our teaching and assessment. And finally, it provides a uniform language. Now, somebody did mention assessment. So, how is this knowledge of taxonomy useful in terms of assessment?
Yes, means whether you want to assess the student at the basic level or at the higher level of their cognitive or the higher level of their psychomotor skills. So those things can be assessed with these different taxonomies.
Whether they're
Correct.
actually bugging up the things or they're able to apply it clinically.
Yes, so it's not just the level, but then what is the domain which you want to assess? For example, you want to assess them on their knowledge. So, what would be the best tool to use to assess the knowledge domain? Or maybe we want to assess them on their hands on skills. Which would be the most appropriate assessment method to assess their skills? If I want them to assess them on the skills, can I use an MCQ test?
A case-based
Not
study.
really. An MCQ assessment can be a good assessment for assessment of the cognitive domain. But if I want to assess the students on the psychomotor domain, I need to have a practical exam or a clinical exam. Okay. So being aware of this knowledge of the domains also helps us to decide the appropriate teaching learning method as well as the appropriate tool of assessment.
And also in
Right?
proper question paper framing also, sir. Question paper
Absolutely. So
framing also it really helps, sir.
correct, sir. So and question paper framing, if it is again, if it is a cognitive domain,
Yes, sir.
then all those theoretical components can be used. If it is
Yes.
not cognitive, if it is some other domain, then we really need to think whether having a question paper would really help in
Yes.
assessing what we want to assess.
Like simple fill in the blanks will check their cognitive level, and if you are doing a case-based study type of question, it will check their applied aspect, whether they are able to, whether they have understood the thing or not. And then for higher things whether they are applying it clinically properly, proper judgment, and all these things, we can check the affective domain with that.
Correct, ma'am. Absolutely. Fine. So before we move ahead now, any questions till now? Is everyone clear with this concept of domains? Because this is what we are going to be building
Can you please
upon further.
summarize the thing, whatever you taught till now in this section? Like suppose we are taking a class, all the domains in relation to the class we are checking the students. Can you please summarize with one example?
I don't know how it is going to go.
Chinmay? It's Gaurang.
Yes, ma'am.
Can I just add?
Yes, ma'am, please.
Mirna, you asked a question when you're taking a class. It's while taking a class, when you're planning for the session, you have to know that certain things are psychomotor skills. So you have to give demonstration. Maybe you'll show video. Maybe you'll explain. What are the domains Gaurang talked about?
Regarding that, ma'am, cognitive domain, psychomotor
So
domain.
what do you understand by cognitive domain?
How much the student has learned. That is simply that students has mug up the thing. Whether
Cognition is the function of the brain.
Yeah.
Cognition is the function of the brain wherein you hear, you take the information in, and the focus what you have given, you understand that. So the first level you are gaining knowledge. okay, your knowledge, but that knowledge may be very transient. But that is why the teacher repeats, gives some tips and all. So when you are preparing a centric relation lecture, the cognitive domain of knowing, understanding is definition. But when you give the cognitive domain wherein little higher, that all next time, I think Gaurang may speak now also, you want them to understand why so many methods, critical appraisal, what about the centric relation, so many definitions have changed, why it has changed. Is it centric relation is the same, but then why people are understanding better, or they are how? So that goes a little higher from understanding to analyzing. So you are preparing a cognitive domain. So depends on what level. That level is called as Bloom's, that will all be taken by Gaurang. So the knowledge what you're giving is cognitive. You understood that. Cognitive,
Ma'am,
understanding, comprehending, applying, creating, all those things. Okay?
ma'am, one more doubt. Suppose whatever definition that Bloom's taxonomy is there, that is from the student's point of view of learning. For each domain, what as a teacher we can do to reinforce that sector? I mean, if I want to improve the cognitive development of the student, where I need to give the basic facts, then from a teacher's point of view, what I can do extra so that it will enhance the thing. Are you
Right.
going to get some tips in this course for that?
Yeah. To make them understand better, you ask them questions. You have interactive class. You can explain first. You can show them. As you said, you enhance their understanding, right? So that is, you prepare a lecture, though it is cognitive domain, there is an affective domain involved. Last time I told you, emotions in education is what people are all talking about. So when you're talking about this, what is the affective domain here? Affective domain is the temporomandibular joint, how much we ask the patient to open, how do we give instruction with empathy, understanding, I mean, how do you give instructions? मुंह खोलो बड़ा, that is one thing. And आपको ये करना है, आपको मैं बोलूंगी जब आप बोले, आप आराम से खोलना, आप आराम से बैठी, अगर आपको दुखा तो आप हाथ ऊंचा कर सकते हैं और आपका फिंगर ऊंचा कर सकते हैं. So that affective domain comes there, and the psychomotor is what we do. So while preparing the lecture, as you rightly said, Mirna, how will you enhance the learning? How will the lecture be planned now? The planning strategies of using different educational methods, different educational strategies, different interaction, and also giving various aids, educational aids, like, you can show a small video, a small clip, PowerPoint, show them the picture, make three-dimensional models, etc. So like that you prepare. And so definitely when they're preparing, you do it, and that's what you carry out in the class. And every time a teacher plans a lecture or a talk, it is always innovation involved. This year you have done centric relation, or maybe instruction to patient, or maybe RPD in some one way. You may like to learn from your last year that student understood this better. You can add to, or you learned a new method. So you can, that think, pair and share, last time we talked about. You can think for half a minute, share with your neighbor for 1 minute, or think for 1 minute, share half minute, and the group completely shares one by. Teacher can randomly say, come on Gaurang, you say, come on Sangeeta, you say, something like that. So it depends upon how do you do. So basically we will be talking about this more and more as the other methods come. We will also talk about it when the competency based education comes, when your interestable professional attributes come. That time also you have to, while planning, maybe think this is cognitive, but everywhere cognitive and affective are involved, psychomotor in many. I think Gaurang will throw more light on that.
Thank you, ma'am.
Yes, thank you, ma'am. I think so. Again, to just further add, I think throughout the year, this is what we are going to be discussing, that how to make your teaching more effective. So there is no one way of doing it. all of us, I'm sure all of you are also using different strategies which we would be wanting you to share. How you are engaging your students in your class, how are you, what are the steps or activities which you are undertaking as a teacher to make the learning experience is more effective for students. And of course, when we have dedicated sessions planned for you to make large group teaching, lecture teaching, small group teaching more effective. So in those sessions, again, we will be sharing some tips, some strategies which will help address your concerns and queries. Fine. So shall we move ahead for the next part of the discussion for today? So, yeah, so I'll share my screen once again. Yeah, can you all see my screen?
Not visible, sir.
Is it visible now to everyone?
Yes,
Full
sir.
screen?
Yes, I can see.
Yeah, okay. So after talking and learning and understanding about domains, let's move on to the topic of educational objectives. So again, I would like to acknowledge the Institute of MET of MUHS. Most of the resources which we would be using, I would be sharing in my sessions have been created by them. That is where I was working for 5 years, and I've gained my experience in medical education. Yeah. So what we will do in this session is this part of the session we will explore our understanding of what we mean by curriculum, goals, and objectives. We'll try to explore the relationships between goals and objectives. We will explore the benefits of writing objectives and learn and practice how to write objectives from all the domains. This is where the knowledge of domains will come in from your own subject specialties. So now here is the first task for all of you. What do you understand by the term curriculum? Can we quickly have your thoughts? Curriculum matlab kya?
A
Meaning
framework
the
of
subjects
syllabus.
taught in the school or college.
Okay. Someone else?
A
Uh,
framework of
Correct.
syllabus
what are the subjects we
or
are going to
course
touch
cover.
on in course? That is curriculum.
Okay. Subject, syllabus. What else?
Schematic timetable of the syllabus, sir.
So the timetable of how
Schematic
the subject
timetable of the syllabus. Yes.
schematic timetable. Okay. Anything else? Curriculum में और क्या आता है? What else would be covered?
Syllabus, sir.
Syllabus. Other than the subject and syllabus,
Method of assessment will also come in.
assessment as well. Yes, absolutely.
And method
So
of
what is
teaching.
curriculum?
Yes.
Curriculum, it is a course design which would include the content, the delivery of the content, that is your teaching learning strategies, the support materials and other learning resources, assessment processes, and all of which are organized in a logical manner. So we have our student. Our goal is to convert the student into a competent healthcare professional, and for that we have the curriculum. So the curriculum would determine what to learn, that is your content and the education objectives. How to learn, that would include the teaching learning strategies to be employed, the assessment methods, and the educational environment. And if you see all the arrows over here, they are bi-directional. So what does this mean? All these processes are interdependent upon each other. No, what you will teach will come from what is the content. What has to be assessed has to be first taught in the first place. Okay, so all these processes are interrelated. Now we have different types of curriculum. You all have heard about outcomes curriculum, which we are currently having. You must have or must be hearing about a competency based curriculum, which is a new format of a curriculum which is being introduced. This is one more format which is known as the spices model of the curriculum, where in one side we have a student centric approach versus a teacher centric approach, a problem centric versus a didactic acquisition, an integrated approach versus a discipline based approach, a community based versus a hospital based approach, an elective based versus a standardized approach, and a systematic versus an opportunistic approach. So these are all different formats. The SPICES model, the name comes from this format, SPICES. So we need to think, when we think about our curriculum, on which side of the spectrum are we towards? Are we more towards the left side or more towards the right side? What do you think would be more ideal? Left or right?
Gaurang, can I intervene?
Yes, ma'am, please.
Curriculum is a Latin word which means a track. Are you able to hear me?
Yes, ma'am.
It's a Latin word which means track. Whenever there is a race, there is a turn, there is a way you go, and you have to remain within those white two lines and career, that is means to run, to proceed. So curriculum is much over and above syllabus. Syllabus is given by university. By curriculum is the way you are going to have taught, how teaching methods, how you are going to assess, and it's a whole package of it being given to the students in a palatable manner. Thank you.
Yeah. And of course, we have an entire dedicated module on curriculum where we would be discussing this further. But I think the message of bringing this over here right now is to understand that our teaching needs to be more student centric, more problem centric, integrated, community based, and in a systematic way. Whereas currently we tend to be more teacher centered, where learning is based more on didactic acquisition of knowledge. We are highly compartmentalized in terms of our disciplines, subject specialties, and totally hospital based. So these are the two ends of the spectrum where our curriculum lies. Now, Robert Major, he was a famous educationist. He has mentioned that if we are not certain where we are going, we may very well end up somewhere else and not even know about it. And as a corollary to this, when we are clear what we have to achieve at the end, the performance improves. So, if we make our students clear right from the beginning what is expected of them at the end of a learning period, chances are higher that their performance will be better. So, that is why we need to have clear cut goals and objectives in place. So, now what do we understand by these terms, goals and objective? What is a goal of education and what is an objective or an education objective? Can we have your thoughts on this? गोल मतलब क्या, अन ऑब्जेक्टिव मतलब क्या?
Say for example, for a BDS course or curriculum, sir.
Yes.
At the end of the course, maybe we expect our student to perform, treat, or say exam, do the diagnosis, treat the case. So like that will be in the goal and objectives of our education.
That's a goal. An object. Okay. Would anyone else like to add to what sir just mentioned?
The goal is the final BDS degree, and the objective is
Yes.
that the person is getting the degree, has the student has got the proper knowledge in all the aspect or not in achieving that.
Okay. Fine. So yes, an educational goal is a broad educational objective which communicates the overall purpose of a curriculum. Whereas an educational objective or a specific learning objective states what the learner will be able to do at the end of a learning period, which they could not do before. Okay. So again, we have our student. Our goal is to convert him into a competent healthcare professional. We have our intended outcomes and objectives which need to be achieved. So the student undergoes the process of the curriculum to ensure that the intended outcomes are achieved. Now let us see a few examples. The goal of a gynecology curriculum for residents will be to develop the knowledge, attitudes, and skills necessary to diagnose, manage, and appropriately refer women who come to the gynec OPD. This is a very large, broad educational goal. But one of the specific learning objectives for attaining that goal is that by the end of the first term, each resident would have demonstrated at least once the appropriate technique of obtaining a pap smear. Okay, so goal is what you expect at the end, and the specific learning objectives are certain, milestones or benchmarks which will help achieve those goals. So we will have a series of different learning objectives which, after all the objectives are achieved, we can say that the broad goal is achieved. Any doubts till now? Are we clear? Any questions, any queries?
Yes, sir.
Okay, fine. So learning is much faster if the learners know their objectives. So again, now this slide has 4 statements. I want you to go through this slide, these statements, and just think which one of these statements applies to you. Okay, so how many of you for statement number 4?
Yes, 3 and 4 are good, sir.
3 and 4. So many of you are already writing and sharing your objectives with your students.
Yes, sir.
Yes, sir.
How about the others?
Writing in my case, it is in 2 and 2.
Anyone for 1 or 2? It's
We
okay.
used to do that only before the
In
world.
our workshops, we have had teachers with even 30, 35 years experience raising their hand saying that they were not aware. So it's absolutely fine. Okay, so now, what are the objectives for this session from me to you? So my objectives for all of you are that by the end of this session, all of you should be able to enumerate the different elements of a learning objective. You should be able to identify in a given objective specific measurable performance. All of you should be able to write learning objectives from a topic from your own discipline. All of you should be able to demonstrate the belief that writing objectives can lead to better learning, and demonstrate the belief that writing objectives is a skill to be practiced and improvised upon. So these are my objectives for all of you. Coming back, I I want you to enumerate and identify ये कौन से डोमेन के objectives हुए हैं?
Cognitive, sir.
Cognitive, yes. But when I say I want you to demonstrate the belief that writing objectives can lead to better learning, this belongs to which domain?
Higher level of
Affective.
cognitive.
It's a belief, it's a behavior. I want you to appreciate the importance of writing objectives. So therefore, this is affective domain.
Affective.
So just to now recap, we just saw the different domains. So now when you will be writing objectives, keep in mind which domain you are referring to and at what level you want to frame your objective. Okay. If you want, you can just take a photograph of this slide. I'll just hold on for a few seconds. Maybe I'll share this slide as well after the session, or if you can just Google it up. This is all, a lot of literature is available on Bloom's taxonomy and Google also. Okay, so a few examples. These are examples of the cognitive domain. By the end of the lecture on gametogenesis, the first year student, what will be able to do? Define gametogenesis, describe the process, differentiate between oogenesis and spermatogenesis. So why is it cognitive domain? कैसे पता चल रहा है cognitive domain है?
Only the
Sir,
facts.
related to mind, and it is just expressing what is being
Define,
observed and
describe, differentiate. These are the verbs which is giving a hint that these are from the cognitive domain. Another example, by the end of the workshop on communication skills, the interns will accept that communication skills are important for development of a good doctor-patient relationship and respond with empathy in interpersonal communication. This would be which domain? Affective domain. Why? Because we want them to accept something or responding with empathy. So these are behavioral components, therefore it is affective domain. One more example, by the end of first 6 months of residency, each resident would have performed successfully in a single attempt endotracheal intubation. Which domain?
Psychomotor.
Psychomotor. Why? Because now we want him to perform. So there's a task or a skill involved over here. Clear? So with this, now any learning objective has to cover these 5 basic elements, which are who, will do, how much or how well, of what, and by when. So when you will be writing your objectives, you have to write them in the form of a written statement, which should be covering all these components: who, will do, how much, of what, and by when. So let's see a few examples in this format. Each resident will demonstrate at least once the correct technique for obtaining a pap smear by the end of the first posting. We saw this example earlier. So who is the learner in this case? Every resident. What do we want him to do? Demonstrate. How much or how well? At least once. What do you want him to demonstrate? The correct technique for obtaining a pap smear, and by when? By the end of the first posting. Okay, so all these 5 elements are covered. And this would be from which domain now? This is an example of an objective from which domain?
Psychomotor.
Psychomotor.
Psychomotor, yes. Why psychomotor?
Because they are performing.
Because we want him to demonstrate. This same topic, can somebody think of a cognitive domain objective? Agar cognitive domain karna, तो how can we change this and make it a cognitive domain?
They have to define the
They'll
topic.
explain. They will explain how to correctly obtain.
Explain, or maybe each resident will describe the steps or enumerate the steps of doing a pap smear. Correct?
Yes, sir.
So it is the verb over here which will determine whether it is a cognitive or a psychomotor domain. I hope that's clear. Another example, each undergraduate student will determine by palpation to an accuracy of plus minus 0.5 centimeters the liver size in a child by the end of the clinic. So again, who is the learner? Every student. What do we want him to do? Determine by palpation. How much or how well? To an accuracy of plus minus 0.5 centimeters. What do you want him to determine by palpation? The liver size. And by when? By the end of the clinic. So how will we assess this? How do we know? Now we are taught this. What would be the best means to assess this?
Are the students being asked to perform the practical work, or they are being asked to define the?
Yes, we will ask them to perform, and we will measure it by either by direct observation or using a checklist. Yes. So if our objective is well written, it becomes very easy to determine how we will assess it as well. Okay, now let us just discuss this component of what we mean by specific measurable performance. So we have an example of this objective in front of you. I want your comments on this objective. By the end of the tutorial, the learner will be able to work with tables in Microsoft. What are your comments on this objective?
So this is a psychomotor domain, so we have to perform what we have been taught.
So you feel it's psychomotor. Okay, fine. What is the task over here? What do you expect your learner to do by the end of the session?
Whether we have understood Excel properly or not.
Understood?
No, we are able to use that Microsoft table. Whether I'm properly able to make a table using the Microsoft.
Okay, so you want the student to make a table. So is the task clear? When we say the learner will work with tables, is this clear? Working with tables.
So I guess it's cognitive level 3, sir.
For more in a refined way, I have to use the terminology. Table is a very vague term, I think. Table of what?
Table of what? And Microsoft kya? Microsoft Excel, Microsoft Word,
yeah,
PowerPoint. That is not clear. Working with tables is not clear. Whether you expect your student to create a table, to edit a table, to draw a table, to modify. What do you expect your learner to do? With working with tables is a broad term. So is it a specific measurable task?
No, sir.
No. Rather than saying work with table, I can specify it by saying by the end of the tutorial, the learner will be able to create a table. Now the task is very specific. Whereas just saying that working with table was very broad. So the message over here is that when you're framing your objective, it should be specific, it should be measurable, it should be, open. There should not be ambiguity in the interpretation of what the expected task is. So whenever you're framing your objectives, make sure that your task is very specific and it should be measurable. We'll see a few examples, a few more examples, and then we'll go on to the activity by all of you. So each participant will enumerate all 5 basic elements by the end of the curriculum. So all of you are the learners. What you should be able to do? You should be able to enumerate how much or how well all 5 basic elements of the objective by the end of the curriculum. And this would be which domain?
Psychomotor, sir.
Cognitive.
I want you all to enumerate the 5 basic elements. How will you enumerate?
Cognitive.
No,
need
no,
to-
sir. It will be cognitive one.
It will be cognitive. It will not be psychomotor. There is no skill involved. You are not going to perform any task. You need to recall from your memory and bring it out. So it's psychomotor. Each participants will construct at least 3 learning objectives one from each domain by the end of the session. This is which domain?
Psychomotor.
Why psychomotor?
Construct.
Construct.
Is it something physically you're doing with your hands?
Construct. Is it combined?
Is it a procedure?
Procedure. Each person will construct this.
You will be able to construct if you know how to do it. So again, this is higher level cognitive. This is maybe at an analysis or a synthesis level, but it is still cognitive.
Application. Okay.
If you know how to construct it, if you have understood the concepts of domains, then you will be able to write the learning objectives.
Sir, here
So
here it
in
is
this
basically
context over
application.
here, it is a higher cognitive domain.
So here it is basically applying the concept, sir. Application.
Yes. You will be applying the knowledge and creating learning objectives. So it is still cognitive and not psychomotor. I hope that's clear. Each participant will appreciate the usefulness of learning objectives in the teaching learning process by the end of the session. Which domain?
Cognitive. Level
Affective.
6.
Affective domain.
Why affective? Because what do I want you to do?
Will appreciate.
Appreciating
Appreciating
the importance of learning objectives, and therefore it is affective domain. Is it clear now?
Yes, sir.
So fine. So now if you have understood the basic components, I hope you have taken it down, who will do how much of what and by when. Now we will go into breakout rooms, and what we will do is now understand the task. After going into your breakout rooms, you can just take up to 5 minutes, pick up any topic from your own subject specialities. All of you are from Prostho, so you can pick up any topic which you are currently teaching or which you are going to teach, and for that topic, frame one learning objective from each domain. So for that topic, one cognitive domain, one psychomotor domain objective, and one affective domain objective. Take 5 minutes in framing that. And then in the next 10 minutes, within your own groups, I want you all to discuss the objectives which you have written with each other. Help each other refine your objectives. Okay, so you can take around 10 to 15 minutes for this. And then we'll come back to the large group and take a few examples. Is the task clear? Yes, no?
Yes, sir.
Yes, sir.
Yeah, so we'll break out into we'll go into three breakout rooms. Okay, let's take a total of around 20 minutes. We will have a breakout room for 20 minutes. In the first 5 minutes, do your individual work. And then in the next 15 minutes, please discuss with each other what objectives you have written. Make sure that the objective of all the 5 elements are covered or not. Try to help each other in revising and reframing if required. And after 20 minutes, we will come back to the large group and take a few examples from each group. Is that fine? Breakout. The 20 minutes, 3 breakout rooms. 20 मिनट में ब्रेकआउट रूम करो.
Okay, sir. Okay.
So see you all in 20 minutes.
સર પાર્ટિસિપેન્ટ અલાઉ નથી કરતા જવા માટે.
Suhanda Viraj, can you all, are you all in a position to select your breakout rooms and go?
No.
ઓકે. અરુણ કુમાર મોબિલાઇઝેશન 2 નરેન્દ્ર ચાલુ છે નરેન્દ્ર.
So I think you are all slowly moving out into your breakout rooms. Once you are, any difficulties, the 4 of you who are still here? Okay.
સર મારે મોકલવા પડે છે, જાતે નથી જતા.
હા તમે નાખી દો.
હા મેં ત્યારે બધાને ફોર્સફુલી મોકલી દીધા છે પેલા ગ્રુપ.
હા બસ મોકલી. બસ સરસ. હવે 20 મિનિટ ધ્યાન રાખજો. હવેથી 20 મિનિટ
ઓકે સર. ઓકે. હા
પૂછું અહીંયા.
7:05 થઈ છે. 7:25 બંધ કરી નાખીશ બ્રેકઆઉટ રૂમ.
7:30 કરજો. જોઈએ 7:25 જોઈએ.
ઓકે સર. હા સર.
સમીક,
યસ સર.
તમે જ્યારે એ લોકોને ટાઈમ કેન્સલ થઈ જાય કે 1 મિનિટ ટાઈમ મળે એ
નહીં,
લોકોને?
એક મિનિટનો ટાઈમ મળે સર.
બસ તો હવે બંધ કરી દો, 1 મિનિટ પછી આવી જાઓ.
ઓકે ઓકે, હા સર.
Yeah. Effective one will be how the student is building a personal touch with the patient.
So welcome back everyone. I did visit all the groups. I saw interesting discussions going on. Yeah, so let's take a few examples. Who would like to go first? Any one objective from any domain?
From our group, Dr. Shilpa will present, sir.
Okay.
Hello.
Yeah, and all of
Hello.
you have to listen and all of you have to give feedback to each other now. Yeah, please, ma'am, go ahead.
Good evening, sir. Sir, my topic of discussion is impression making. The impression making, the goal is to set the goal is to make the first primary impression, make an impression for the final years. They should know how to make the impression till the end of the final years. So the objective of this task will be the student should be able to know exactly starting from the anatomical landmarks, the impression techniques, all the types of impressions available and all the techniques of manipulation impression, and then the selection of impression materials for individual patient. So after that, the management of the patient, which involves the affected domain and communication skills based on how the student is going to communicate with this patient and how well
I think, sorry to interrupt you, clear cut written,
Yes, sir.
can we have clear cut statements covering those 5 elements that by the end of the session or the learning period, what will the students be able to do?
Students will have to be able to make the impression independently, sir.
Sir, can I just want to, at the end of the final year, students should be able to define the impression material, should be able to classify the different impression materials, complete denture impression, should be able to different impression techniques, sir, able to describe different impression techniques. And then students should be able to communicate to the patient about the procedure. Then last one, students should be able to perform the impression making procedure, sir.
So I think let's ask the others. Let's take example, what do you feel? Any comments or any feedback on the objective framed by the group? The others,
Could be made more specific,
are
sir.
all the 5 elements covered? Is the objective specific?
Yeah, sir. We have made it in under 5 headings. I guess Meena madam will present or Meenakshi madam will present. We have made it very specific into those 5 points.
Actually, you go ahead. Have you noted down the points or should I go?
Madam, you can go. I have also noted down. You can go. Not an issue, madam.
So our topic is teaching centric relation to the final year students, and to whom we are teaching the students. Which year student? That is the
Which
final year
students?
student. Final year students. Then what are the objectives? To impart the knowledge, centric relation, all the definition, all the fundamental aspects, what are the different category to the students. Then the second part is to demonstrate the centric relation. And third part is they should be able to differentiate between the centric relation and the eccentric relation. That is two category, because we are pinpointing on the centric relation. Then when they will be using it during the clinical application, and we'll be checking whether they're properly able to do it clinically. And the last objective is whether when doing the procedure, are they able to build a personal relationship with the patient, or they are doing simply mechanically. That will assess the affective domain.
So I think, ma'am, the feedback what I would like to give you is all these points are important, good, they are covered. But when we talk about learning objectives, every component can be an independent objective in itself. So
Okay.
आपके जो initially जो cognitive की जितने की components जो थे, they could all have been independent objectives. Don't try to club 2-3 things into a single objective.
Okay. So that means you want to
It's
say
okay
that.
to have 3 or 4 cognitive domain objectives. Don't club everything into a single objective.
Okay. Sir, during explaining the objectives, do I have to cover all the domain, or should I stick to only one domain, that is the cognitive one? Or the only one level of the
You
cognitive?
can have any one level of
Exactly.
cognitive is fine.
Okay.
Exactly.
But we have to incorporate. But I have to
A
incorporate
single objective statement objective will be covering any one level only. A single objective cannot or should not cover multiple levels. You can have it as a separate independent objective.
Okay, sir, got it.
Okay. Yes. Someone else? Any affective domain example over here? आपने affective domain का बताया?
हाँ नहीं सर बताएं कि how the student while doing the procedure is able to build up a personal rapport with the patient, or simply doing it mechanically. Like explain the patient, what they are being compassionate to the patient.
So you want your student to develop a personal rapport.
Yeah.
Is it specific? Is it measurable? How do you know that he has developed a personal rapport?
That we can.
What will he do which will indicate that he has developed a personal rapport?
Okay, we can get a feedback from the patient.
वो फीडबैक तो बाद में, बट रैपो डेवलप हुआ है कि नहीं वो कैसे पता चलेगा? What would be the indicators of that?
Is the patient comfortable or not?
So then that can be an objective, that your student made the patient comfortable during treatment.
Yes.
Is different from saying कि he developed a rapport. So developing a rapport would be broad.
Okay.
There will be multiple dimensions to develop. So we need to make it clear, specific key what exactly is expected from the student when you say that the student is able to develop a rapport.
Pardon me, sir. I have a doubt here.
Yes, sir.
Can I speak, sir? Can I speak?
Yes,
sir?
please.
Sir, like our
Yes, sir.
objective
Please go ahead.
the objective basically was like teaching centric relation to students. In this particular exercise, our objective was teaching centric relation to the student. So when we are speaking of evaluating it, it has to be related something to centric relation. I guess if we are evaluating something else, we are deviating from our objective. Am I right, sir?
Sir, I am just getting a connectivity. Can you just be a little bit louder, sir?
Sir, like our objective before we formulated this task was teaching centric relation to the students.
Okay.
Now, by the end of our task, is it mandatory for us to evaluate about centric relation or something else about centric, like something other than centric relation? Because patient
Okay,
scenario,
I
it
think,
goes, there
yeah,
is
I got your question now. Sir, I got your question now. I think
yes,
the message which we want to give is that if whether your objective is clear or not,
okay, sir.
one indicator for judging that is to see from your objective whether you are able to frame an assessment question or not. So if from that objective, are you easily able to frame your assessment?
Okay.
What was your objective? Can you repeat again, sir?
It was recording, teaching centric relation to the students.
Hello.
Hello.
Hello, sir. Hello.
Yes, sir. Can you share that example again of centriculation?
The teaching of centric relation to final year students. That was our first objective. So, am I audible, sir? Hello?
Yes, you're audible.
Okay.
So, any feedback from the other participants, since you all are the subject experts, is the objective clear the way it was framed?
Actually, as madam is presenting, sir, rather than on the focusing on the curriculum, they are focusing on the only teaching methodology here. So in that case, they have to say the objective, saying that at the end of the class, the student should be able.
And this was from which domain? Sorry to interrupt, sir. This was from which domain?
Which one, sir?
Hello, sir.
So actually, the
Yes, so at the end of the class, it can be a class, it can be a practical.
Sir,
You can define what a learning period.
sir,
It can be a weekly posting. It can be a 6-month learning, sir, also. So as a teacher, you have to identify what is the time frame.
Sir, just
It
I
can be
have
a
a small
class, it can
doubt.
be a practical.
Yes, sir, I have a small doubt. Within the objective, should we incorporate the assessment component also? I think that could be taken as a separate entity, no, sir?
No, an objective will not cover the
Yes,
assessment component.
correct.
The
Exactly.
assessment component was just to help you reflect and understand whether the objective is specific and measurable or not.
So,
So if you are able to frame your assessment properly from your objective, assessment you are finding it to frame.
am I audible?
Yeah.
Can we speak?
Ma'am, you are audible, but sir is not.
No, we can
Meenakshi,
discuss a little. We can discuss a little.
Meenakshi, if what I
Yes, sir.
understood is,
Yes, sir.
when we are formulating any objective, it's
Yes,
not
sir.
mandatory for us to involve all the three domains.
Correct, sir.
That is what
Yes.
I understood.
Yes. And each objective has to be measurable. As sir was
Exactly.
mentioning, whenever we are making a listing all the 5 or 4 objectives, in each objective, there should be a measurable entity. How exactly are you going
Exactly.
to measure the objective?
Basically, the definition of each component of your objective.
And it should be measurable at the end, how you're going to evaluate the objective.
Exactly. Let's see what he's saying now. I guess he's coming on.
Has everybody done the same way? Am I right? Anand
We
sir?
have done, Dr. Meenakshi, we have done it
Arun
in a
sir?
different way.
Yes, sir.
Ours is like, this is SLO, specific learning objective. Mine was teach ED students to make impression.
Okay, sir.
So under this, we have categorized into cognitive, psychomotor, and affective. So
Okay,
we have covered all three domains, and we frame the five sub objectives of this. Like
okay.
who will be the category? It's a resident. The resident will explain the numbers of number becomes how much objectives of impression making by the end of first BTS.
Okay.
So this will cover our cognitive domain.
Cognitive domain.
Then
Okay.
goes to the psychomotor domain. The resident will make one impression of maxillary arch by end of second BTS. So he'll making it. So by the end of that is the third is affective domain. The resident again, he will understand the importance of making maxillary impression in the success of complete dentures by the end of final year. So what we have done is we have explained each
Duration.
domains.
Correct, sir.
Yeah.
Sir, all these domains are in the first objective. Your primary objective is who?
See, what we have done is we have given understanding, taking one SLO, the learning objective is ultimate goal of our understanding is making a successful successful impression by end of final year.
Okay.
So under this, each domain which needs to be covered is being explained.
Don't you think the duration is quite long?
Sir, can I just intervene over here, all of you?
Yeah, sir.
The cognitive and psychomotor seem to be well. Can you just repeat the affective domain objective which you just said for this in this example?
The group which is being told is the residents, the students of third BTS. They are supposed to understand the importance of making the impression in making the denture successful.
Okay, so if that now my question over here is what is the attitude or the behavior involved over here? Understanding the importance of something. I understand something is important. That is my knowledge. That is my cognition. I understand that something is important.
It is not
how does it reflect as an attitude or a value or a behavior?
So it needs to be the success of complete dentures in making patient comfortable in eating.
So fine. So that I understand it's important, and therefore I will skillfully do the procedure. Isme affective domain, I am not able to understand what is the affective domain clearly.
Affective domain means they have to do it dil se without mechanical.
No, sir,
they have to do it without.
Let's say, sir, we can formulate that way. No, effective domain will be whether the student is doing a primary impression within a stipulated period of time. Say for 15 minutes, like for border molding, we give 45 minutes, border molding and secondary impression, we give 45 minutes. Let's say we can keep a target that the primary impression has to be completed within 15 minutes or 20 minutes.
But that affective domain is not covered there, sir. The affective domain, affective component is not covered there. That's what sir is asking, sir. The last component.
There also, I think the psychomotor ability is being tested.
Again, yes.
Exactly.
How fast you are able to do it, how well you are able to do it.
How have you made the patient comfortable when you're making the impression? Probably that would be your affective domain.
Yeah, I agree.
Yeah. Then that would be also fine.
Anand, sir?
Yes, madam.
Anand, sir? Vinna, ma'am, is it clear, ma'am, now?
I think that's clear now.
Clear, ma'am?
Affective means dil se.
Yes, ma'am. Yes, ma'am.
With a bit of emotion involved.
Yes.
I have also made one attempt, and and the last portion, that is affective domain, also for me also it is difficult. I have framed it. I don't know how well it is. My topic which I have taken is pre-prosthetic surgery. Okay. So the first part is the students will explain at least once the different pre-prosthetic surgical technique at the end of 4th year BDS.
Okay. We'll
So that is my cognitive.
cognitive domain. Okay.
Yeah. When it comes to the psychomotor, I cannot ask the final year student to do a pre-prosthetic surgery. So for that, how I have formulated is that he will have to assist a OMFS surgeon in that.
Okay.
The students will at least once will surgically assist the OMFS surgeon in performing any of the pre-prosthetic surgical technique at the end of 4th BDS.
Okay.
So that psychomotor also I could evaluate. But when it comes to the affective domain,
Instead of
yeah.
Instead of assessing, can we modify it like to assist, whether they are able to assist?
Yes, that is psychomotor assisting. That psychomotor aspect I have given, but the last part I can only say appreciate the importance of different pre-prosthetic surgical techniques.
And that also will come under cognitive only, ma'am.
Madam,
Yes,
I do
yes.
agree with
How
Nirna,
to
madam.
formulate that is very, very difficult.
I think I think so. Now, when it comes to affective domain, we all realize what is the most easiest to frame. Which objective was easy?
Cognitive.
Psychomotor.
Cognitive and psychomotor was also to a
Cognitive and
certain extent.
psychomotor were easy. Affective domain is difficult because we get confused in terms of the knowledge and the behavior.
Yes.
So always think what is the behavioral aspect which you want your students to gain or develop. That is the affective domain. Baki, they would have, let me give another example. All of us know driving, yes, two-wheeler, four-wheeler. How did we learn driving? Many years ago, we first joined a driving school. We were first taught that what is driving. If you're driving a car, what are the different functions of the steering? What is the function of the brake, accelerator, clutch? What are the functions? What do the different symbols indicate? Red signal means stop, green means go ahead. That was the knowledge given to us. Then when it came to skill, we taught and we learned how to ride our two-wheeler or four-wheeler, whatever. We first practiced under somebody's supervision. Maybe if we had joined some class, there would be a coach besides us who helped us learn the clutch drive. We have reached that level of automation. Now talking about attitude, we have learned that we should stop at the red signal. That's our knowledge. But do we really stop at the red signal while driving? Is our attitude, is our behavior. And whether we are stopping just because a police fellow is standing over there, or whether we are stopping irrespective of no traffic being there and no police havaldar being there, still we are stopping because we are supposed to stop at the red. Communicate well is the affective domain. Now, when it comes to an examination or an assessment, in an exam, all students will naturally be in the best of their behavior because they know it's an exam. So is that a true reflection of their affective domain? That is what we need to introspect on. So when would we say that the students have really developed a strong affective domain? Is when they are practicing all these behaviors, even in our absence, in regular day-to-day practice, in regular clinical interactions with the patients. Only then we can say that yes, the students have got or developed the affective domain properly. So when it comes to affective domain, always think in terms of the student-patient or the doctor-patient behavior and the interaction and the communications. I think that will help you all to frame your affective domain objectives more clearly.
Madam made, pardon, sir, but Madam made it very clear that when anything related to affective domain means it's a domain of heart. So if we understand that we incorporate the moral values in the student, then the goal of incorporating the affective domain in the student is achieved.
Sir, agreed. So the point over here is, why are we talking about objectives and writing objectives, is because first we need to put it down, what they need to achieve. Then the next step will come is teaching them how to achieve that. So this is just the starting step of identifying what the learners need to learn. We are identifying that by the end of the learning period, this is what they need to gain. And then we will deliver that. And after that, we have to assess it.
Okay.
Because this is just the first step of identifying what they need to learn.
Just to add that, sir, I think for that affective domain, wherever the procedures they are performing directly in the patient, we can just add the student should be able to perform ethical management of the patient.
Sir, what do you mean by perform ethical management is not clear. Ethical, how we, so you know, that's what I said. Ki think about assessment. हम इसका assessment कैसे करेंगे? How do we say that the student has performed ethically?
वो एक DOPS procedure means where you can directly observe the students while they perform.
DOPS is direct observation of procedural skills. It's again more of psychomotor domain. Yes, there is some component of behavior also.
Yes, sir.
No, so the point is, always think कि जो objective frame किया है, whether it is specific, whether it is clear, whether the meaning of the task is clear, whether the task is clear.
Correct.
It's very easy to say that students should become an ethical practitioner.
Correct.
But how do we come to know that he is an ethical practitioner? What would he do in his behavior to show us that yes, he is now an ethical practitioner? Those are the points which need to come in the objectives. Otherwise, saying students should become an ethical practitioner is a goal. That's my goal.
Yes,
student ethical practitioner ban jayega, but how do I know? What are the small indicators? Those will be your objectives.
Correct.
So these are the things which we need to identify when we talk about objectives, and then of course teach them in a more structured way. Slides to share with you. Just give me 1 minute. Yeah. So this is where we were finally. So you all realize writing objectives is a skill. It takes time. So we finally need to reflect on what we want our learners to accomplish. Then the key element that determines the quality is the verb. We need to choose it appropriately. And an important number is to keep the task, numbers realistic. So we need to keep on practicing this. As you all realize, several cycles of writing are required to achieve a reasonable number. That we need to be patient, creativity, flexibility, and non-specified learning. And finally, as you all did now, do it together. Sit in your department, sit with your colleagues, write your objectives together, ask them for clarity of interpretation. Because if you have well-written objectives, finally, which you give to your students, you might not have much more to do. And having clear-cut objectives will take care of half your problems. Because you are clear what is to be taught, students are clear what is to be learned from by them. So what we will do is, now all of you have written your objectives and we have had this discussion. So based on this discussion now, just go back to the objectives which you have individually written yourselves. You can refine them further, and after refining them, we will be asking you to upload them on Moodle as an assignment. Is that clear? So I'll request Dr. Chinmay to kind of just create an assignment tab for this activity. You can submit this, or maybe as a discussion forum, and we can even discuss the objectives over there as well on the LMS, not on Moodle. Sorry. Any further questions or any burning queries?
I have some work. Can I leave, sir?
Yes, we are all going to leave, ma'am. Now, yes. So thank you everyone for joining. I hope it was
Sir.
some interesting, something new for you all today. Keep
Sir,
on
one
writing and
question, sir.
practicing these objectives. You can even share it on the WhatsApp group, and we will continue the activities and interactions further.
Okay, sir. Okay, sir. Thank you.
Thank you very much, everyone. Thank you.
Thank you.
Thank you, sir.
Thank you. Bye-bye.
Sandhya
Bye.
ma'am, belated Onam.
Oh, thank you, Meenakshi, and happy Onam to all of you.
Thank you. We'll come to Kerala for
Wish
Sadhya.
you the same, ma'am.
Please,
Yes.
please do come.
Yes. Okay. Thank you, everyone. Bye-bye.
Thank you, sir. Thank you.